Hello everyone, welcome to my channel Ashutosh Bhosle. Today I am here with a new case presentation, that is a case presentation on carcinoma of distal stomach. Let's get started. These are my contents. Let's we start from the introduction. What is the introduction about carcinoma of stomach? The carcinoma of the stomach is also known as the distal gastric carcinoma. Is a malignant tumor that develops in the lower portion of our stomach. It is most common type of the cancer, which is often associated with the chronic inflammation of the gastric lining, particularly due to the infection with the bacteria Helicobacter pylori, that is H bacteria. Several risk factors have been associated with the distal gastric carcinoma, including a diet rich smoked, pickled, or salted foods, tobacco, smoking, a family history, and genetic predispositions. Symptoms of the gastric carcinoma can vary, but common signs include the abdominal pain, unexplained weight loss, nausea, and vomiting. These are most common symptoms. Since next is early satiety, means feeling of not satisfying our food which have been engulfed by the body, means we have not properly eat, like not early satiety means that is feeling of completeness of having food. Next, a feeling of fullness of the stomach. So what is the treatment plan for the distal gastric carcinoma? It is depend on the stage of the cancer and the overall health of the patient, the individual factors. They may include the surgery to remove the tumor, chemotherapy, radiation therapy, or a combination of the modalities. In advanced cases where curative treatment is not feasible, palliative care aims to alleviate symptoms and improve the quality of life. So, what is the epidemiology? According to IARC, collaborators predict that annual burden of the gastric cancer will increase to about 1.8 million new cases. The burden of gastric cancer is highest in Eastern Asia, most common cancer type in China as well, in Bhutan, Kabul, and Tajikistan. Gastric cancer is the fourth most common incidence of cancer and second most common cause of cancer death. So let's move our main phase of patient data collection. The age of the patient is 45 years. We didn't we did not disclose the name of the patient in any case study. So the patient's initials have been given. So name of the patient MD, age 45 years, sex female, height 5.1, weight 37 kg. What is the date of admission to the hospital? It's 19th of August 2022. The hospital. Never really know what's going on. Address Ali Nagar, Patna, Bihar. Bed number 4th floor, bed number 207. Chief complaints. What are the chief complaints for this patient? A 45-year-old patient was admitted to the hospital with chief complaints of pain in epigastric region from the last 6 months, vomiting after meals from the last 6 months. On examination, physician found that pain over left epigastric region and she was non-vital stable. So, what is the allergy? Allergy known to any drug is unknown. History of present illness. The patient was complaining about abdominal pain for last 6 months in the upper half abdomen, sudden in onset initially. It was colicky in nature. Colicky means with a pain-free period, non-radiating, aggravated by food ingestion and relieved by the antacids. It didn't affect his daily activities and there were no episodes of nausea or vomiting or heartburn sensation there. The patient complained about the weight loss of 20 kg and severe loss of appetite. Vomiting after every meal, which was sudden onset, occurs immediately after the meal from the last 6 months. Also, the patient had generalized body itches, itching all over the body. There was a history of fever treated locally and no history of chronic illness. Patient give a history of passing dark terrace stools for 15 days and reduced the frequency of bowel movement once in a 3-4 days and had a constipation. So past history of surgery. The patient has undergone a tubectomy. What is the tubectomy? Tubectomy is a permanent. It is a permanent contraceptive method. That is the fallopian tubes cuts and tie. So also there is no history of radiation, chemotherapy, and the cancer. Also there is no history of diabetes, hypertension, asthma, TB, and thyroid diseases. Family history, no history of family having the cancer. Personal history, see having the mixed diet means veg plus non-veg, both. Loss of appetite present due to the abdominal pain and vomiting. The patient didn't eat properly. Loss of weight present, patient was weighing 57 kg 2 months ago and now she weighs 37 kg. She lost almost 20 kg weight in 6 month duration. Bowel frequency reduced to the 3-4 days. A history of passing dark terrestrials. Bladder habits normal and regular. No history of addictive habits. What was the department of the hospital? Inpatient department, B block, 4th floor, gastro-oncology department, Mahavir Cancer Sansthan, Patna. So what are the diagnostic test has been done by the clinician said to patient is a CBC, complete blood count, LFT, liver function test, KFT, kidney function test, HIV, human immunodeficiency virus test, HIV test, HBs, AG, hepatitis test, hepatitis B surface antigen test, PTINR, prothrombin time, international normal ratio, HCV, hepatitis B virus test, EEC, electroencephalogram. Here by mistakenly EEG is written. It is ECG, electrocardiogram. C chest X-ray, CXR, sonography, CEA, calcio-embryonic antigen. Next is the biochemical investigation. And this hemoglobin, neutrophils, lymphocytes, monocytes, and MCH. These are abnormal values which have been first hemoglobin is low, means not much low, it is till a normal limit. Neutrophils are less, lymphocytes are increased, monocytes are increased, MCH is decreased. So the liver test seems to be the normal, nothing is there abnormal. And these are physical examination of the urine test and electrolyte serum parameters. So immunology report, embryonic antigen test CEA. The observation was found to be the 69.67 nanogram per dl. And what is the normal ratio? That is less than 3.0 nanogram per deciliter. What is the interpretation here? Increased serum levels are found in the patient with colorectal cancer and malignancy including the gastrointestinal tract, breast, lung, ovarian, liver, and pancreatic cancer. So next test is alpha fetoprotein test, AFP. Normal, this is the normal ratio, 1.86, less than 10 mg per year. Interpretation, concentration of AFP in hepatocellular carcinoma and germ cell tumor form ranges to several millions of international unit per milligram. AFP is normal. Next is the biopsy report. Here, histopathology report of biopsy. Specimen received on 3rd of November, 3rd of September 2023. Sample tissue from the distal stomach has been collected. Gross received 2 bits of soft tissue measuring zero point 0.1 to 0.2 centimeter. Comment adenocarcinoma grade 1 has been confirmed. So the biopsy report confirmed that the participant has distal stomach cancer, adenocarcinoma grade 1. Diagnosis: after performing the diagnostic test, patient was diagnosed with adenocarcinoma grade 1. Adenocarcinoma refers to the type of cancer that originates in the glandular cell, which are responsible for producing mucus and other fluids. In this case, cancerous cell have developed in the distal part of the stomach, which is the portion of closest to the small intestine. What is the vital examination? Pulse rate 76 beats per minute. BP is a normal 122 by 80 mmHg. Oxygen level is 98, temperature 80, 98.5, respiratory rates is 18 breaths per minute. Next, ultrasonography report was USG was done on 19th of December 2022, and the result were declared as follows. Asymmetrical thickening of the wall of the anthropologic region of the stomach was noted, with a maximum thickness of 1.5 centimeter in the anterior wall, likely a residual disease. Minimal interbowel fluid was noted. Few peripancreatic and periportal lymph nodes are seen, largest measuring 1.6 into 1.2 centimeter in the peripheral region. So these are points of diagnostic tests. What is the history? What are the chief complaints for the patient? Now we need to treat this patient of gastric cancer. What will be the treatment plan? Then the plan is NSAT to remain based on the response to the chemotherapy. Neoadjuvant chemotherapy. NAC means neoadjuvant chemotherapy refers to the use of chemotherapy to reduce the tumor size prior to the main treatment course. Then what is the chemotherapy plan? Plan is a FLOT. So what is a FLOT? FLOT means there are four drug in the FLOT. F for fluorouracil, L means leucovorin, O oxaliplatin, and T paclitaxel. FLOT is a chemotherapy drug combination that doctor may use to treat cancer. Often it is used for stomach and esophageal cancer. So fluorouracil is 50 mg per meter square, leucovorin 200 mg meter square, oxaliplatin 50 mg per meter square, and paclitaxel. It is so the paclitaxel is a 500 mg per meter square. It is written by mistakenly 50 mg. So it is next drug treatment plan. There are three chemotherapy cycles. First cycle is of oxaliplatin, injection oxaliplatin, leucovorin, doxycycline, and 5-fluorouracil. The strength 100 mg, 250 mg, 60 and 1000 mg. And the date given is the 31st 12 2022. Next chemotherapy cycle second, injection oxaliplatin 100 mg once daily by IV route on 24 of January 23, leucovorin 250 mg dose once daily by IV, docetaxel 60 mg by IV OD on the 24, and injection 5-fluorouracil 100 mg OD by IV route. Next is the chemotherapy cycle number 3, injection oxaliplatin 100 mg, and the date 13 of February 23, leucovorin, docetaxel and 5-fluorouracil. This has been given by the interval of the days by 2 weeks interval. Next, drug treatment. Some other kind of drugs has been given to treat the side effect of anti-cancer, anti-neoplastic agent drugs. First drug is pantoprazole. The paclitaxel drugs and oxaliplatin, platinum coordination compound drug, can cause high nausea and vomiting. To treat this, the pantoprazole, which is proton pump inhibitor, which has been given, strength 40 mg OD oral on the date of 23, 24, 25, 26. Next is tablet Allegra for allergy 120 mg OD oral, and the time is 9 p.m. at night. Ondansetron, which blocks the 5-HT3 receptor in the brain, which has been not covered by the blood-brain barrier. So the nausea and vomiting has been episodes has been increased. So due to the taxol and platinum coordination compound oxaliplatin. So this has been given on densitron 8 mg thrice a day TDS oral, and it is given on 24 for 2 times for 23 thrice a day and 26 also. tablet levosis 5 mg OD, and injection pods 1 ampule, which is a tranexamic acid, which is 40 mg BD, means both a day, once daily, no, twice daily means BD, IV, and 24, 25, 26 given. Next is a paracetamol, pan 40, pantoprazole, cremafin, which has been used for constipation, oroforex and levosis. So the what will be the pharmaceutical issue? The drug interaction of 5-fluorouracil with docetaxel chemotherapy drugs may increase the risk of side effect, especially those that affect the bone marrow or gastrointestinal tract. Patient may experience a greater number of more severe side effects such as nausea, vomiting, diarrhea, loss of appetite, mouth sores, abdominal pain, delayed wound healing, and most important is anemia. The patient will be sick and anemic. Using 5-fluorouracil together with oxaliplatin, other chemotherapy drug may increase the risk of side effects such as nausea and vomiting. It is most commonly occurring side effect due to the release of platinum ions in the body, which may be a metallic test, can cause induce nausea and persistent vomiting in the patient. So what we have to do is give ondansetron to block the chemoreceptor trigger zone in the brain, that is 5-HT3 receptor antagonist. Avoid the consumption of grapefruit juice while taking the docetaxel because juice can significantly increase the blood levels of docetaxel. This may increase the risk of side effects such as nausea, vomiting, diarrhea, mouth sores, blood retention, nerve pain, numbness, tingling, muscle pain, and weakness. So, what is the role of pharmacist in this? Cisplatin administered to the patient confirmed first that ondansetron had been must administered to the patient. Before giving the cisplatin, the patient should be must administer the ondansetron, that is 5-HT3 receptor blocker to avoid the vomiting and nausea. It will reduce the frequency of vomiting and can prevent the adverse event. If the patient develops symptoms or any adverse effect, any chemotherapy drug gives, then we should have to give the drug for symptomatic relief to the patient. Then avoid the food grape juice as I told earlier. Their juice because they act as an enzyme inhibitor or the cytochrome 3A4 can increase the concentration in the body and cause toxicity. So the next, if possible, do patient counseling with regard to the patient's general health and give him sympathy, give a proper plan for management in the cancer patient. Pain management is most important. Patients every time suffers from the pain, so there is a need of pain management. Also, the patient needs the sympathy. The patient taking chemotherapy agent can suffer more from angina, which may develop to manage it. So, need to give the vitamin B complex and folic acid medications. Patients should strictly follow the doctor's advice given for the diet. In case of any emergency, glucose should be given to the patient as per the standard operating procedure. SOP. So these are my references which I had referred for this case study. Thank you. Thank you so much for the listening.